Stop pulling at me!
When are we going home?
Can you please come in? Please have a seat. My name is Dr. Alia.
Thank you. My name is Sarah, and this is my son, Aziz.
Thank you for coming today, Sarah. Hi, Aziz.
Hi.
How can I help you today?
Aziz started school this year, and the teacher called me many times because he is causing trouble in class. He is always talking to the other children around him when the teacher is talking, and when they tell him to behave, he doesn't seem to listen. I was worried that he was going to have some problems when school started.
What were you worried about?
Well, he has so much energy. It seems like nothing can keep his attention for more than a few minutes. He has been like this ever since he was 2 or 3 years old. I thought it was just normal behavior. But when I see my sister's children, so well behaved.
Aziz, is it true that you are always talking in class, even when it is time to listen to the teacher?
Yes, but it is because the other child doesn't listen to me and I forgot the teacher was talking.
Oh, I see. And do you get in trouble by your teacher?
Yes, but I don't mean to.
Okay, well, let's see if we can understand what is happening at school. Do you want to draw something while your mom and I talk?
Yes.
Aziz? Say thank you. I'm sorry about that. He shouldn't have grabbed that from you. But he does that all the time. Takes things, runs off. Sometimes he starts talking when other people are talking. It's like he doesn't think.
Aziz's symptoms so far: excessive overactivity, extreme difficulties remaining seated; excessive impulsivity, frequently doing things without forethought; reported impaired attention. Before asking about the problem behavior in more detail, what should you ask about? Ask about school performance and the child's daily routines. Are they affected by the overactive behavior and inattention?
I understand. You might be very frustrated. It sounds like he has had these behaviors for some time. Since he started school, has he been able to complete his assignment?
I thought he was doing his assignments, but the teachers told me they are never complete. He's very smart, but if he doesn't do his work, he may not get passing marks.
Mom, we got to draw in school today, and I drew a picture of our family and the teacher said it was very good.
Can you see that we are talking? Why don't you finish your drawing for the doctor? He can hardly sit for more than 5 minutes. He gets distracted so easily, and he always has to go look to see what is happening.
It sounds like he is very good at drawing. What are some other things that Aziz is good at?
He is very active and is good at sports.
Aziz, what sports do you like to play?
I like football. I wish I could play every day.
That's great. And what is he like at home?
My husband and I are so tired at the end of the day. I feel like I am always scolding him. Every morning, I tell him to get changed for school, eat breakfast, and get his school bag ready. I have to remind him over and over again, but he still forgets something.
Explore. Explore the impact of environmental factors, including fear or trauma, medical problems. Rule out other priority conditions.
Have there been any recent changes at home or in the family?
Nothing I can think of.
What do you and your husband do when he doesn't listen to you?
My husband and I disagree on how to discipline Aziz sometimes. My husband says I scold him too much, and that's why Aziz doesn't listen to me. He thinks I should punish him more and give him more things to do, but he can hardly finish one task. Why would I give him more? We try to talk to him and explain calmly, but sometimes we scold him and even spank him. Aziz, please stop moving. What do you need in my bag? Go get the chair. Sit down. And we don't go out much because I just don't know what he'll do. He really can't sit still.
Aziz, you were drawing really nicely. Can you finish your picture and then write your name on it? I can see he keeps you busy. Can I ask you some other questions?
Sure.
I'd like to know more about his development when he was younger. Do you have his health card?
Yes.
Rule out medical conditions or other priority conditions.
You have kept a very good record of his health. I see that he is growing right on target and met all his milestones. He was talking and walking earlier than most children. Has he ever had any convulsions or lost consciousness for any reason?
No, he is very healthy.
And overall, he is a happy child?
Yes, he is always smiling and playful. Too playful, in fact. Aziz, don't touch that. Put it back. I'm sorry.
It is okay. I understand. I'm glad that you brought him in today. It's helpful to see some of the behaviors you are telling me about. How is he with other people outside the family? Does he fight with other kids? Or seem cruel or lie?
He has a hard time sharing with other kids, but doesn't get into fights. And actually, he never lies, even when he knows he'll get into trouble. He's not a bad kid, but I think that's what other people think of him when he causes so much trouble.
Based on symptoms presented by Aziz, what behavioral disorder should you consider? The symptoms presented so far have persisted in multiple settings: home, school, doctor's office, etc. Exceeded those of other children of the same age and developmental level. Started before age 6. Lasted at least 6 months. Caused significant disruption in child functioning. Consider attention deficit hyperactivity disorder, ADHD.